Hello, I'm Bill Blackburn, Mayor of Kerrville. As you probably know, since March, there's been a leadership group representing the community and the county coming together to talk about what's happening with COVID-19, what we need to do, testing that's available, and sharing in responsibility of responding to what's going on. And so today we have done that once again. And you will hear this morning from several people about their particular area that they're working in, have responsibility for, and give you some update on what's going on. We will hear from Chief Eric Maloney, Fire Chief, bring us up to date on some statistics. And then Corey Edmondson, CEO of Peterson Health, and Dr. Mac Blanton, the Chief Medical Officer at Peterson Health. And then Mark Faust, the Superintendent of Schools here in Kerrville. Following that, I'll make some brief remarks, and that will wrap up one more community update. So at this time, we're going to go to Chief Maloney, and if you would share with us some information.
Thank you, Mr. Mayor. Real briefly, want to kind of give an update on kind of what we're seeing in the community as we move forward with the COVID-19. Next slide. The current cases we're seeing, the active cases, we're at 186 cases in Kerr County. Out of those, we also have 1,000 that are recovered, 18 deaths, and currently there are 15 hospitalized. I believe that's 11, dropped to 11 today. I think an important factor when you look at this chart as we move forward is that 186 active cases almost matches where we were on July 11th with 189 active cases for Kerr County. What changed at that point in July was the governor's mask order came in on July 3rd. And after that is when we started to see the decrease in the number of cases since then. However, the mask order has been in place since then, and yet we are back to 186 cases. And we'll hit on that in a little bit. Next slide. The signs and symptoms that are important, I think it's important for the community and individuals to understand as we move forward in the flu and the cold and flu season, is that 78% of the people experience a fever. 57% have a cough, 31% have fatigue, 25% loss of smell, 23% difficulty breathing. But other symptoms out there of chills, headaches, muscle aches, loss of taste, loss of appetite, sore throat, runny nose, congestion, nausea, and diarrhea. These all mimic the cold and flu season, but it's very important to understand that any unusual symptoms that could be COVID or lead to COVID. Symptoms may range from mild to severe. In fact, some patients or some people are actually asymptomatic. Next slide. So if we experience any of these symptoms that are unusual at this point, it's important to get tested. So it's important to get tested, to get isolated and or quarantined if you're in close contact. Our testing options locally, so Peterson Urgent Care at 1740 Junction Highway, so they will test for symptomatic only. Peterson Medical Associates at 1331 Bandera Highway. You can call there for an appointment. You can call the main number. Franklin Clinic also offers here locally at 723 Hill Country Drive. So you can pre-register with them online, and they have the drive-through schedule for 2 times a day. And then those living outside Kerr County, Myers and Kerr and Bernie, you can call for an appointment out there also. Next slide. But for those individuals here, we're also setting up free public testing, and that's another opportunity for us. And the Hill Country Youth Exhibit Center, we have 2 of those scheduled. Next Wednesday, November 25th from 8 to 4. These are walk-in clinics that you can walk in and get tested. And then after that, we have another one on December 3rd from 8 to 4 also that you can get tested. And we're continuing to schedule more of those as we go through the holidays. But those also with our neighboring Gillespie County, so at Lady Bird Park up at the Pioneer Pavilion, they have one next Monday, November 23rd. Test results we're seeing back on these is anywhere from 24 to 48 hours. So you can go up there, get a free test. It's a walk-in, and you'll have those results back if you are concerned for that, definitely before going into the holidays on this next weekend. Next slide. So I want to talk a little bit about best practices because I think this is important. As we said earlier, the mask order was a best practice that changed Kerr County and brought those active cases down from that 189 and slowly brought them back down to a very more manageable number. Close contact out there is what we're seeing. This is some of the challenges that presents the community, and that the CDC defines close contact is anyone within 6 feet of someone who has COVID-19 for a total 15 minutes or more 2 days before the symptoms started. So this is a challenge. This is the challenge that goes with quarantine, because close contact is sometimes at that point before they actually had symptoms there. So other best practices for that is don't go to work sick. So definitely in the cold and flu season, do not share the community food or drink. We're going to see that coming into the holidays moving forward. An important thing to remember because of that close contact. So because of that high risk of shared eating and drinking utensils. So masks are the key to reducing the spread of the virus. So, and I say that because we saw that over the summer. We saw the impact of that, of not wearing masks and then being mandated to moving forward. Social distancing, even during the holidays. The Department of State Health Services has some good information that you can provide and actually talk through as a family to see what we need to do for the holidays. Follow the quarantine and isolation instructions. That does not mean we got to go to HEB, we get to go to the movies, we get to go to drive-through. It's very important that part that we follow those instructions to reduce the spread. So even if you were feeling well at that point, because it does provide that risk and is why we're seeing the cases where we're at. Be smart and accountable over the holidays, and we'll enjoy an even better holidays next year. Next slide. And last, I'll leave you with some things from the Department of State Health Services for Thanksgiving that we're evaluating as a family. So some of those lower risk activities out there are the small dinner with family and friends who live in your household, virtual dinner with family and friends, moderate risk activities or small outdoor dinner with family and friends who live in your community, and then those high risk activities are that going shopping in the crowded areas before or after Thanksgiving, or those large indoor gatherings with people from outside your household. So I'll leave you with that and turn it back over to Mayor Blackburn.
All right, thank you very much, Chief. And now we go to Peterson Health, Corey Edmondson and Dr. Mac Blanton.
Hey, good morning, community, and Chief Maloney. That was an excellent presentation. Appreciate you doing that. Very well said. Peterson Health continues to manage COVID instead of it managing us. And I'll share with you certainly that we're concerned about the uptick that is occurring in our county and across the state and across the nation. We're not immune to that. Just this week alone, just Monday, Tuesday, Wednesday, Thursday, we're averaging 20 positive patients a day, just the testing that we do. And that testing is ending up at a 16% positivity rate. I challenge the community based on what Chief Maloney was saying and the things that we're doing in our own facility. I challenge the community with a goal to get to 5% positivity rate very soon. And I challenge that to try to get there within the next 6 to 8 weeks as we trickle down and do the things that we need to do as a community to manage this. It is manageable and that threshold is achievable. We've been there. While we're continuing to operate smoothly at full speed here at Peterson, we're also seeing double digits in the hospitalizations. We've had upwards of 15 patients in the hospital with COVID, and today, as Chief Maloney said, we have 11. But our staff is doing an incredible job each and every day caring for all the needs of our patients, and I'm thankful for them. Chief Maloney talked about the testing. I won't review that in great detail. Just to reiterate, symptomatic patients show up to our urgent care center. You don't have to have an appointment. Just show up and we'll get you in, get you scheduled, and get you tested. If you're asymptomatic, maybe you've been exposed to somebody, just want to test, then schedule an appointment at our Kerrville Medical Plaza. That is next to the movie theater. You can call 896-4200 to schedule an appointment. Our COVID hotline, also, that's the same number. They're also seeing tons of uptick in number of people calling to inquire about a variety of things. We're averaging maybe even 100 to 150 calls a day. In addition to helping the community answer those questions, we're seeing a lot of COVID questions and concerns around businesses calling, employees calling about returning to work and what the policy is and what they should be doing. I would encourage you and businesses to look at the CDC guidelines and follow those. The Texas Education Agency has their protocol for schools, and healthcare workers have a protocol, but CDC gives some good background on that. While cases are climbing, and for reasons, we do have reasons for optimism. And people are like, oh, wow, give me some optimistic things to think about. We are facing it together, but we're more confident today in our treatment protocols, and we're more experienced, quite frankly, and aware of this beast of a disease. There's real hope out there, and there's a promise for an imminent vaccine and additional therapeutics. And I'd like to, you've seen Mac Blanton, Dr. Mac Blanton, our Chief Medical Officer before, but he'll be here. I want him to discuss the vaccine, the protocols, and the different types of therapeutics that we have going on here at Peterson.
Yes, good morning. My name is Mac Blanton. I'm the Chief Medical Officer of Peterson Health. I'd like to brief you on a couple of things that will give us some hope that we'll be able to get beyond this viral scourge in the near future. The first is the COVID-19 vaccine. If you look at the media or read in the media, I'm sure you've seen that there is a large pharmaceutical company called Pfizer that has developed a vaccine that is quite efficacious in the range of 94 to 95%. And that company, it was announced today, is applying to the Food and Drug Administration, the FDA, for what is called emergency use authorization of that vaccine. So if the company is able to get emergency use authorization of their COVID-19 vaccine, the distribution of that vaccine should follow shortly after that across the country. And Peterson Health, as well as other entities in the community, as I understand, are certified as COVID-19 vaccine providers. So once the vaccine is rolled out and once we are able to obtain vaccine at Peterson Health, we are prepared to start administering the vaccine to people in our community. The priority for administration of the vaccine has been sorted out with CDC and the Food and Drug Administration, and is determined that healthcare workers and first responders such as EMS will be the highest priority as those at the most risk. And then based on vaccine supply, it will be rolled out to those others at high risk, such as those with advanced age or comorbid medical illnesses, or those that are living in settings such as nursing homes. So very exciting news that it looks like we may be able to have a efficacious vaccine available for our community in the near future. The other thing that I would like to brief on is the capability that we now have of administering a medication called bamlanivimab. That's a big name of a medication. It is what's called a monoclonal antibody. It's the same type of medication that you may remember was given to President Trump. That was called Regeneron there, and that was actually a polyclonal antibody. This is a very similar medication. This medication was allocated within the past week across the nation. We have our initial allocation, which is a very limited number of doses, but this is a medication that we can use to treat patients with COVID-19 who have recently been diagnosed and have mild to moderate symptoms, but are not sick enough to be hospitalized with their illness there. And the studies on this medication have shown that we can decrease viral load, we can decrease symptoms, and we can significantly decrease hospitalization rate in these COVID-19 patients. So it's exciting that we have a directed therapy for the virus in those patients, which we have not had previously. So it's something to offer to those patients that may very well prevent them from progressing in their illness and becoming hospitalized for the COVID-19. The last thing I would like to mention is to make a plea for the use of masks. We're in the midst of a significant surge in the virus in our country, our state, and in our community. And although masking is not 100% effective, it is definitely effective in preventing the spread of the virus. So I highly encourage you to use a mask, especially if you're indoors in any public area. If you are outdoors in the open air, it's probably not needed unless you are within 6 feet of anybody else or in a group setting where you cannot socially distance. So masking is going to be important in mitigating the risk of spread of COVID-19 as we wait for things like the COVID-19 vaccine to become available ultimately. So thank you very much.
All right, thank you. Appreciate it very much, and good information. Let's go now to Mark Faust, the Superintendent of Schools of KRISD.
Thank you, Mayor. I'll just give a very brief update. Kerrville ISD currently has 25 active positive COVID cases in our district. I will say, like the city, the state, and the nation, we have seen an increase in activity. And I will tell you that 2 weeks ago, we posted on Friday afternoon that we had 8 active cases. Last week, we had 20 active cases. And this week, today, we'll post that we have 25 active cases. But to put that in perspective, every day, for 5 days a week, for 13 weeks roughly, we have had 4,800 students and about 700 employees, so approximately 5,500 people interacting on multiple campuses each day. We do not want any cases of COVID-19 in our community, but at the same time, we feel very confident in saying our mitigation strategies are working. We're hanging our hat on masks and our cleaning protocols. We think those are making a tremendous difference in Kerrville ISD and in Kerr County and again in Texas and across the nation. There's really not any strong evidence that schools are super spreader locations. In fact, just the opposite. We have heard a rumor this week that KRISD was going to close, but that was just that, a rumor. We sent out a little letter, I guess, to our community and to our stakeholders on our social media yesterday, reinforcing that our staff is doing incredible work on keeping our kids and themselves safe, enforcing the cleaning protocols and the screening protocols and mask wearing in our campuses. We have no intent of closing. We haven't neared any of the self-imposed thresholds that we had set for ourselves to temporarily close campuses for deep cleaning. So we're counting our blessings, and we know with the continued hard work from our staff, we will be able to do what is best for our students in our community, and that is teach them in person. So just incredible thanks go out to our faculty and staff that have been working so hard to make sure that our kids are safe and that they're keeping one another safe. And we will continue to offer in-person instruction in Kerrville ISD.
All right, thank you, Dr. Faust. Let me conclude briefly with a couple of things. One, when this group of leadership has met since March, as it happened again this morning, somebody said, we're working on this, we're trying to do this. Somebody else says, hey, we can help you with that. And that has happened over. There's such collaboration and cooperation behind this. And I think it serves the community well. Let me say a word about masks. Early on in the COVID-19 pandemic, there was some debate, the mask work, the mask help, whatever. Now it is clear that masks work. And when you don't wear a mask, you're in danger of catching COVID-19, but also spreading COVID-19. I've repeatedly made an appeal about wearing masks, but this week I was in the HEB and they require customers wearing masks. And here's a couple coming down the aisle. She's wearing a mask. He's got his just hanging on his ear, which is kind of like saying, nobody can tell me what to do. Dean and I were in a restaurant. About half of the wait staff had their masks under their nose. Well, the nose and mouth is a primary way to spread the disease and to catch it as well. Look back through the window there of the kitchen, and the cook had her mask completely under the chin. Folks, that's dangerous. And I just want to make another appeal. Please wear masks, do social distancing, wash the hands, do the basic things to make a difference. I had a good friend this week who lost his father. His father got sick last week with COVID. He died on Tuesday. This thing is real and it is dangerous. Thank you for being a part of this community update. Goodbye.